When a freckle-faced young James R. Clapp from rural North Carolina was stricken with tonsillitis, then appendicitis, he was exposed to the fascinating world of medicine.
The doctor would come in and he would feel my side and take his pen and mark it around. It was his reassuring personality and all of that sort of thing that sort of boosted me up.
And inspired him to want to be a doctor. Dr. Clapp went on to become internationally known for his groundbreaking research on kidney physiology, an organ for which there was little knowledge in the early 1960s. Beginning in 1963 and lasting nearly 40 years, he was a pillar of the Duke Department of Medicine, helping to launch the Duke Division of Nephrology and ushering in Duke's kidney dialysis and transplant programs.
Jim Clapp is viewed nationally as one of the founding members of the modern field of nephrology.
In addition to his pioneering kidney research, for more than 20 years, Dr. Clapp was highly admired as a caring clinician, compassionately treating patients with advanced kidney disease and hypertension.
He was a doctor's doctor. He developed a reputation very, very quickly as being one of the great clinicians in internal medicine, in nephrology, in the private diagnostic clinic.
Dr. Clapp first came to Duke as an undergraduate student in the late 1950s. He spent 3 years here, then enrolled in the UNC School of Medicine, where his interest in the kidney was sparked by working in the lab of Dr. Lewis Welt, a prominent renal pathologist and physiologist.
I would begin to see patients with kidney disease and all of that sort of stuff where there was no real treatment for it. You know, that was before the days of dialysis, before the days of transplantation and so forth. And I just got caught up in it.
While at UNC, the Korean War was brewing, so Dr. Clapp decided to enlist in the U.S. Navy Medical Corps. But during his physical exam, there was a problem.
I didn't pass the eye test, so the examiner said, why don't you go home, get in a dark room, close your eyes, eat like carrots, and come back the next day. When they were moving out of the room, the eye chart was sitting there, and I wrote it down.
The next day, he began reciting the eye chart when someone noticed something a little odd.
One person in the room said, he's reciting the names of on the eye chart from yesterday. And, and they said then, listen, if he wants to go to the Navy that bad, go ahead, passed him on.
Before serving active duty, Dr. Clapp spent 4 years of internship, residency, and fellowship at the University of Texas Southwestern Medical School in Dallas, where he worked with the legendary chair of medicine, Donald Selden, and noted nephrologist Floyd Rector.
And by the 4th year, I was really into it.
After Southwestern, he became a lieutenant in the United States Public Health Service and spent 2 years at the National Institutes of Health's National Heart Institute, working on kidney and electrolyte metabolism research with notable physiologist Dr. Robert Berliner. During this time, he performed groundbreaking kidney research using an emerging technique called renal tubular micropuncture, in which a fully functioning kidney of a test animal is examined under microscope outside of the body.
His development of technology allowed the understanding of how the kidney controlled acid-base balance and how these new emerging classes of diuretic agents were working.
This seminal work caught the attention of Duke Chair of Medicine Eugene Stead, who in 1963 recruited Dr. Clapp to help Ike Robinson develop the Division of Nephrology and the kidney dialysis and transplant programs. He stayed at Duke until his retirement in 2001, leaving a powerful legacy. He was one of the first 3 Duke faculty members to be appointed as a Howard Hughes investigator. He served on several national committees and founded the acclaimed Duke Executive Health Program. His accomplishments have been recognized by the establishment of an endowed distinguished professorship in his name, an endowed fellowship in nephrology, and a research endowment at the Duke Center for Living. Dr. Clapp and his wife Janet have been married for 50 years.
Thank you.
They lost their first son, Bobby, to cancer last year and have 1 surviving son and 5 grandchildren in Charlotte and Chicago. His favorite pastime is flower gardening, He has a colorful collection of petunias, peonies, and marigolds that he gives great care and attention to, just as he did to his patients for so many years.